Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Dozens of jobs exist in healthcare that are not doctors or nurses, but are still important members of the healthcare team. Radiation therapists, physical therapists, respiratory therapists, and many others. Here with me to talk about the array of health professions is Katherine Beissner. She's a professor of physical therapy and dean of Upstate's College of Health Professions. Welcome to The Informed Patient, Dr. Beissner.
Thank you very much.
You'll be handing over the reins later this year when you retire from dean of the College of Health Professions, but you've overseen this college at a time when interest in jobs in healthcare has been climbing, so I wanted to talk with you about these health professions. Upstate offers bachelor's, master's, and doctoral degrees. Collectively, what percentage of students have job offers upon graduation?
Nearly 100% of our students have jobs when they graduate from here, most often with multiple job offers. The exception to those rules are students who are going on to further graduate study.
So that shows there's a huge demand for these careers.
Yes, there really is. I went to Indeed.com just a little bit ago just to check to see if we could all get jobs, and indeed we can, and we don't even have to move.
So why do you think people are interested in maybe not becoming doctors or nurses, but looking for other roles in healthcare?
Well, doctors and nurses, that's what we all know, right? Everybody knows what doctors do and what nurses do, but that's a long path to the profession of medicine. To be a physician takes a very long time, and that's disconcerting for many people. And it costs a lot to go to school for that long. There are ways to manage it, but it is an expensive path. And for nurses, sometimes people are put off by bodily fluids and shots and things like that nurses do. So they want to be in health professions. Many people want to be there to help people, but they don't want to do those things. They don't want to go to school for a very long time, and they don't want to deal with body fluids. And there's all these other careers that most people don't even know about, don't even think about. So when they do find out about these programs, they become interested and excited about them.
Let's talk about some of the bachelor's programs that Upstate offers. And are these programs that people can enter straight out of high school, or are there some college level prerequisites?
There are college level prerequisites for all of the programs at Upstate. Students have to go someplace else for a little while. Most often around here, they go to OCC or another community college and then transfer into one of our bachelor's degree programs.
Which ones are most popular?
Right now, it's very interesting. It ebbs and flows in the different areas. Imaging is really very popular these days. So medical ultrasound, diagnostic ultrasound has always been very fascinating. Everybody loves to see those babies, right? That's what you think of when you think of ultrasound. There's other body parts that we also use ultrasound for. But then radiography is also increasing in popularity these days. And then there's specialty of CT and MR. We have those degree programs, always job needs there. Less applications for those degree programs because you have to have a radiography degree first. But there are plenty of jobs out there.
I see. What about like radiation therapy, respiratory therapy? How long of a program are those?
Our bachelor degree programs are all 5 semesters long. So you go an entire calendar year and then 2 more semesters to get out. So they have similar lengths. And it's interesting. I know you're going to ask me about salaries in just a little bit. I'm going to say they are pretty much approximately the same salaries too. If you get into specialty areas like diagnostic ultrasound, that's a little bit higher salary, but most of them are about comparable when getting out of school.
Now, what would someone who goes into medical biotechnology be doing for their job?
Medical biotechnology is the one that's a little bit different from the rest of them. That's not a healthcare provider kind of job. Oftentimes, medical biotechnologists get jobs in industry doing preparation of biological specimens and products, or they can work in research labs. Those are the 2 most common areas of practice, I'm thinking, these days, especially in this region.
Well, medical laboratory sciences, would that be working in a hospital lab maybe, or?
Yes. Medical laboratory scientists are also known as medical technologists. That's the more common historic name. And they work in labs, either in the hospital setting or independent laboratories.
Now, for these jobs, what is the starting salary ballpark for all of these? If students are really interested, what can they look forward to?
So we're looking at in the high 50s to the 70s for these bachelor degree programs. Ultrasound might be a little bit higher than that. And then if you go on and you get your specialty in MR or CT, you'd be up around $80,000 for a first job. Not bad.
And yeah, not bad at all. And do some of these positions give room for advancement or to move on to something else?
There's definitely room for advancement in all of these degree programs. It's really one of the characteristics of a bachelor's degree is that you can advance up a career ladder better than if you got an associate's degree. So you can become a lab manager, you could become a shift manager. There's all sorts of different ways that you can progress when you have a bachelor's degree.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Katherine Beissner, Dean of the College of Health Professions at Upstate and a professor of physical therapy. Now let's talk about the graduate programs. These would be options for people who already have a bachelor's degree, right?
That's correct.
Can you tell us about these jobs and sort of the outlook for each?
Certainly. Let's start off with our newest degree program in behavior analysis. So behavior analysts typically are making about $70,000 when they finish their calendar year, one full calendar year degree program. So they come and they study with us and do a research project. They do a little bit of clinical work. When they graduate, they still need to do more clinical work in order to get their full certification to practice, but they fulfill all of the didactic requirements. That's like lecture, classroom kind of stuff. Behavior analysts can do a lot of different jobs. So I think of behavior analysts, I think of the behavior analysts at Upstate who work with children who have severe behavior disorders, or those who work with children who have autism, trying to learn new skills or manage some problematic behaviors. But really, behavior analysts can do a whole range of different jobs. They look at organizational behavior as well. They can be animal trainers because they are masters at analyzing behaviors and looking at what triggers those behaviors. It's a fascinating field.
So let me ask you about that. What kind of an undergraduate degree would the student typically have?
Most often we see people coming in with backgrounds in psychology or education. I'd say
Okay.
pretty much the same split there.
All right. Now, what about clinical perfusion?
Yes, clinical perfusion, also commonly called cardiovascular perfusion. So these are the people who keep the heart-lung machine going while the doctor's doing surgery. Very scary kind of job, right? You'd want your clinical perfusionist to be highly, highly skilled. I always say they have to have nerves of steel. They have to be able to work in high-pressure environments. Really fascinating career.
And I know Upstate also offers physician assistant training.
That's true. The Physician Assistant Studies program is a 2-year master's degree, so it's a little bit over 2 calendar years, one additional summer there. They spend a full year in didactic coursework, and then they go out for a year of clinical coursework.
What are those starting salaries like for PAs?
So for PAs, we're looking at about $110,000 a year. That's a good salary. Clinical perfusion is higher than that. And then I would say, let's back up to behavior analyst. I already mentioned that, about $70,000.
And then the physical therapy profession is a doctoral degree now. What can you tell us about it?
Well, it's my favorite profession because that's what I do or did for the longest time. Physical therapy, the degree program, ours is now an 8-semester program. Typically, they're 3 years. And that's a really fun profession. I got to say that it's great to see people progressing after a severe or debilitating illness or injury, regaining their function and able to do things for themselves again.
What's the average starting salary for a physical therapist?
Physical therapists are starting out around $75,000. Actually, let me say it really depends on what environment you're working in. So some practice areas like geriatrics, the salaries are higher because it's perceived to be a less desirable population. I don't get that, but that's okay. And then pediatrics might be paying a little bit less depending on the hours. So just taking ballpark figure, 75,000 and up.
Okay. Now that's the field that you chose. What attracted you initially to physical therapy?
Well, I read a book. And there was a physical therapist in the book, and I decided that's what I wanted to be. And I decided I wasn't going to change my mind about it. And fortunately, I had a mother who was very concerned that I was being very stubborn about this. And so she helped me find some opportunities to shadow physical therapists, to volunteer in physical therapy and occupational therapy to make sure I was choosing the right thing. So that was really good. I decided very young, and it just really worked out well for me.
Is that something you recommend people to do these days if they're vaguely interested? It's a big commitment, so you need to know what you're getting into, right?
That is exactly it. And that is exactly it for all of our professions. You need to know what you're getting into, even though some of the degree programs are only 2 years here. So 2 years of prerequisite work and 2 years of study with us. It's a lot of work. So these are not easy curricula because you need to be really good at what you're doing. The health of your patients depends upon it, right? So you need to know what you're doing before you get into it. That's really what we look for when we're interviewing prospective students.
From what I understand, admission to the College of Health Professions can be very competitive. When you're considering student applicants, what do you look for that signals to you that the person is going to be able to be successful in the field that they're choosing?
So first off, they need to be strong in science. Every one of these degree programs requires a strength in science and math. So that's the basics, that's the fundamentals. Then we look to know whether or not they understand what they're getting into, what the profession actually is, not some idealized version of what a physical therapist is, for example. We don't all work with Super Bowl teams, but what the actual guts of the profession is. So those are two fundamental things. Then we want to look to see if we can get a sense of students' work ethics and the reason for their career choice. If you're choosing a career because you want to make money, it doesn't exactly say that you're going to be a successful student. You're in it not for the best reasons. So we're looking to make sure that they really have a good understanding of the career and that they have a good reason to be wanting that career.
Well, that's good to know. Well, thank you so much for making time to give us this overview, Dr. Beissner.
It's a pleasure. Thank you very much for the opportunity.
My guest has been Katherine Beissner, the Dean of Upstate's College of Health Professions. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.